Okay, welcome everyone to the deep dive. Today, we're tackling something that comes up a lot if you work with puppies or kittens, and that's coccidia.
Yep, it's a common one. And we're looking specifically at a document called Coccidia Control for Puppies and Kittens, the Power of Toltrazuril.
Right. So our plan is to really just pull out the key info from this source, what it says coccidia actually is, why it's, such a big deal for young animals.
And then really get into the specific approach this document focuses on, which is using Toltrazuril for control and treatment. We'll just stick to what this paper presents.
Let's do it.
Yeah.
So first up, what is coccidia, according to this document? It makes a point of saying it's not a worm, not bacteria.
No, it clarifies it's a protozoal parasite, tiny single-celled, and its main target is the intestinal lining.
Especially in the little ones, right? Puppies and kittens.
Exactly. Their systems are still developing, more vulnerable.
Okay, so what signs does the document say to watch out for?
Well, the classic one is diarrhea. It describes it as often soft, maybe even with mucus or sometimes blood.
Not good.
Yeah.
What else?
Weight loss, or maybe they just aren't gaining weight properly. Dehydration is a big risk too.
And just generally being off, like low energy.
Yeah, weakness, acting off their food, just not themselves.
Yeah.
And the document really stresses that in severe cases, especially in very young or maybe immunocompromised animals, it can actually be fatal.
Wow. Okay. And it spreads easily.
Oh, incredibly fast. That's a key point in the source. Think about environments like kennels, catteries, even just homes with multiple pets. Once it's there, it can move through a group quickly.
So the takeaway from this section of the document is pretty clear then.
Yeah, basically. Don't wait. If you see signs, the document advises acting immediately because of that speed and potential severity.
Okay, so moving on to treatment. The document brings up some, let's say, older approaches first. It mentions things like Corid or Albon.
Right. It acknowledges that some people use those.
Okay.
But the specific point this document makes is that those treatments are, well, described as only suppressing the coccidia.
Suppressing meaning, like keeping it in check but not getting rid of it?
That seems to be the implication in the document, yeah. That they might manage the symptoms for a bit, but maybe don't fully eliminate the parasite itself.
Which leads us to where this document puts its main focus.
Exactly. It pivots pretty hard towards Toltrazuril, specifically talking about a 5% solution.
And what's the big claim about Toltrazuril according to this source? Why is it different?
The core argument presented here is that Toltrazuril targets the entire life cycle of the coccidia, all the stages.
Ah, okay. Not just suppressing the active ones causing symptoms, maybe.
That's the idea presented, yes. They suggest that hitting the whole cycle is a key advantage for actually clearing the infection.
The document also makes a couple of other claims about it. Something about the immune system.
Right. It claims Toltrazuril doesn't suppress the animal's own immune system, which is obviously a good thing, if true.
And nutrients.
Yeah, and that it doesn't strip essential B vitamins, which can sometimes be a side effect concern with other types of treatments.
So this document sounds pretty positive about Toltrazuril.
Extremely positive. It uses the phrase game changer. It claims it works fast, it's easy to dose, and importantly, that it's safe when you use it correctly.
Okay, so if someone's using it based on this document, how do they actually do that? It gets specific on dosing, right?
Very specific. It talks about the 5% liquid solution, which translates to 50 milligrams of Toltrazuril per milliliter of liquid, so 50 milligml.
Got it. And the dose itself?
The dosage recommended in this document is 10 milligrams for every kilogram of the animal's body weight. So 10 milligrams per kilogram.
Okay, 10 milligilligrams. And how often?
It says once a day for 2 days straight, 2 consecutive days.
That sounds pretty short.
It does, compared to some other protocols you might hear about.
Does it give examples? Because
right.
Calculating that for tiny pets sounds tricky.
It does, yeah. It says, for instance, a little 2-pound animal that's about 0.9 kilograms would need roughly 0.2 milliliters per dose. Very small amount.
Okay, 0.2 milliliters. And maybe a slightly bigger one, like 5 pounds.
For a 5-pound animal, the example given is about 0.45 milliliters per dose.
Right, so you really need to be accurate.
Absolutely. The document emphasizes using a 1 LML oral syringe for precision, especially if you're treating a whole litter or multiple small pets. You need that accuracy.
Makes sense. Any other practical tips from the source on giving it?
Yes, a really important one. Shake the bottle well, thoroughly before every single dose.
Why is that?
Because it's a suspension. The actual Toltrazuril can settle out at the bottom, so if you don't shake it, you might not be giving the correct intended concentration. Could be too weak or potentially too strong if you get the stuff at the very bottom later.
Ah, okay, crucial step. Shake well.
Definitely. And the document also mentions that help is available for calculating doses if people are unsure.
Does the source provide any, real-world stories to back this up? Anecdotes?
It includes a couple, yeah, to sort of illustrate the points it's making.
Like what?
Well, one example is about a litter of 6 French bulldog puppies. At 3 weeks old, they apparently started getting soft stools.
Okay, typical age for coccidia issues.
Right. And the document claims that after just 1 dose of this Toltrazuril 5% solution, their stools firmed up and their energy levels bounced back by the very next day.
That's fast. What's the other one?
The other involves kittens in a rescue situation. It mentions there is even a fading runt among them.
Oh, tough situation.
Yeah. And according to the document, they treated all the kittens based on their weight, and the change within 48 hours was described as night and day. A huge improvement.
Interesting examples, and these tie into another point the document makes about when the damage starts, right?
Exactly. The source argues that coccidia can actually begin damaging the intestinal lining before you even see obvious symptoms like diarrhea. It's working silently at first.
Which is why they lean towards prevention.
Precisely. This leads the document to strongly advocate for preventative dosing. For puppies, it suggests this is often done around 3 weeks of age.
Okay, 3 weeks.
And then it recommends considering a second preventative dose around 6 weeks old.
Which is often right before they might be going to new homes, encountering new stresses or environments.
Right. So the general takeaway from the source is that being proactive is better than waiting for an outbreak to happen, especially if you're bringing new animals into your home or kennel or taking young pups to places where other dogs frequent, like parks or training classes early on. Prevention is key, according to this document.
So the document lays out a suggested preventative schedule then.
Yeah, based on what we just discussed, the first dose is recommended around the 3 to 4 week mark.
Okay.
And then the second dose is suggested at 6 weeks old. Or, it adds, you could give that second dose whenever you first notice any potential signs of coccidia appearing, if it happens earlier or later.
Got it. And is it just about the medication?
Oh, definitely not. The source is very clear on this. Medication alone isn't enough. Good hygiene is presented as absolutely crucial to break the coccidia life cycle.
Makes sense. What kind of hygiene?
Things like cleaning bedding daily, really thoroughly disinfecting surfaces, floors, crates, food bowls, water bowls.
And keeping things dry. I remember reading that coccidia likes moisture.
Exactly. The document mentions keeping the environment dry is important, as dampness helps the parasite survive longer outside the host. So, clean and dry is the goal.
Now, this document we're referencing, it talks about a specific product. Does it say where people can find this Toltrazuril 5% solution it discusses?
It does. It specifically points to a website, Toltrazurilshop.com.
Okay, Toltrazurilshop.com. And what does the document say about them or their product?
It states that this vendor offers the Toltrazuril 5% liquid solution, the 50 mg/ml concentration we talked about.
Right.
And it claims they also provide pre-measured dosing guidance, which could be helpful given the small amounts.
And there's a notable claim about vets.
Yes, a key claim highlighted in the document attributed to this vendor is that no vet visit is needed to purchase the product from their site.
Okay. Important distinction there. What else does the source say about this shop?
It mentions the vendor states they are trusted by breeders, rescues, and pet owners across the country.
And lists some benefits they claim.
The document includes claims from the provider like fast shipping, that their product is backed by real-world results, and it quotes them describing it as no filler, no fluff, just effective, breeder-trusted parasite control.
Strong marketing language there.
It is, and the document also provides their contact info if listeners want to look into it themselves based on this source. The website, again, is www.toltrazurilshop.com.
Okay.
Email listed is info@toltrazurilshop.com, and there's a phone number, 850-400-3546, which the document specifically notes can be used for help with dosing questions.
All right, so let's try and summarize the main thrust of this document then. What are the key takeaways it wants readers to have?
Well, first, the core message is definitely that coccidia is sneaky, it's fast-moving, and it can be a really serious threat, especially to young puppies and kittens. It can sweep through a group if you don't address it.
And the solution presented in this document?
The document strongly advocates for using Toltrazuril 5%. It presents it as the effective way to stop coccidia because, it claims, it targets the entire parasite life cycle, not just suppressing it.
Okay. And the claimed benefits of going this route, according to the source?
The document frames it as being cost-effective, pretty easy to administer with a short 2-day course, and importantly, Fast-acting. The implication is that it avoids needing antibiotics, maybe avoids long treatment courses, and takes the guesswork out of it.
So a clear perspective from this particular source.
Absolutely. And, thinking about everything this document lays out, what really strikes me is that emphasis on speed. How quickly coccidia can apparently spread, and maybe more importantly, how it can start causing damage before you even know it's there.
Right, that subclinical damage idea.
Exactly, and it makes you consider the implications for managing these vulnerable young animals. The source's argument really pushes towards having clear protocols and being ready for timely intervention rather than just reacting after the fact. Given how fast things can apparently go wrong, having a plan based on this kind of information seems, well, pretty critical if you're responsible for these little lives. It makes you think about preparedness.